Hi everybody, Dr. Scott Keller from Synergy Chiropractic Spine and Joint Center. Today I'm going to talk to you real briefly about two important functions of the foot and the ankle. We've been talking over the last week or so about the squat and how important it is to be able to squat. These two things having to do with the foot and the ankle are of utmost importance because the feet are really our foundation. So we all probably know people who've had plantar fasciitis or heel spurs, Achilles tendonitis, shin splints, and then obviously knee pain, hip pain, back pain. A lot of those problems can start and originate in the feet. The first thing I'm going to talk about, I'm going to slip off my shoes so I can show you, is the tripod of the foot. What does that mean? Well, basically if you think of a tripod, you think of a triangle. If you put a point on the base middle of your heel, and then you draw a line up to the base or the ball of the foot underneath the big toe, and then over to the ball of the foot under the little toe and connect the dots. That's basically the triangular tripod of the foot. It's really important to maintain equal amounts of pressure on all three of those points when you're doing a squat, or if you're doing a deadlift, or just even when you're once again, doing daily chores. What happens in a lot of people is they have overpronation or oversupination, so really flat feet or really high arches. Now sometimes those are structural problems that we need to really work on, but a lot of times you can kind of do some work to self-correct some of this stuff. So for example, if I have really overpronated or flat feet, flat arches, a lot of times my knees will kind of dive in towards each other like this. If I have oversupinated feet or basically high arches, a lot of times we become more bow-legged. That can present a lot of problems and issues in and of itself. So what you can start to do, and preferably with bare feet or with socks on, is just start feeling the ground with your feet. Not digging your toes into the ground, but just underneath the ball of your foot, the big toe, the little toe, and the heel. Just start kind of swaying back and forth, side to side, and just feel the ground. That fires proprioception, and it kind of gives the body a lot of good input just to feel the ground. If you have really flat feet, flat arches, try to lift the arches up a little bit, not by digging the toes in, but again, just by kind of contracting the bottom of the foot as you sway back and forth and side to side. If you have oversupinated or high arches, kind of do the opposite of that. Just try to kind of settle into that, let those relax, and just feel the ground into your feet. Okay, so that's the tripod of the foot. Now in a squat, what's really important is as we descend, we maintain, again, equal pressure on all three of those points. That's going to give you the most power, and it's going to give you a good function and position through your knees, hips, and then into your core and your spine. So the biggest problem that we see is people's heels coming off the ground, number one. Number two, overcorrection with taking their knees out into that oversupinated high arch position, or overpronating, collapsing the arches into the ground, and then their knees come into this position here when they try to bend down or squat. So none of those are really good. It all starts in the feet. So what we're going to do is, as we do this supported functional squat again, I'm going to do this barefoot. I'm just going to feel those 3 points, and I'm going to try to go down and just feel all of the equal pressure on the bottom of the foot, okay, as I go down and up. Another challenge from there would be to do something on one leg. So if you do a single leg stance, you're going to feel your foot wobbling. And again, just trying to maintain equal pressure into all three of those points would be an awesome thing for you. All right, the second thing that's really important that has to do with that a lot is dorsiflexion of the ankle. So the ankle joint right here between your leg and your foot is called the ankle mortise joint. Dorsiflexion is basically the action of bringing your toes up towards your knees. So plantar flexion is pointing down, dorsiflexion is coming up. If we don't have good range of motion in that joint, you're going to see a lot of dysfunction or compensation. So the most common thing that we see is, again, it messes up the tripod of the foot. So as someone starts to squat, they don't have good dorsiflexion in their ankles, and so their heels come up, their knees shift forward in order to keep themselves upright, and then this is how they end up squatting. Or if they don't do that, they have poor dorsiflexion. If they try to keep their heels on the ground, they're going to end up shooting their butt backwards and then bending over and squatting like this. Neither one of those is real great. So this is where you see a lot of people put weights underneath their heels if they're in the weight room squatting, and that kind of braces or compensates for that lack of dorsiflexion, so then they can get into their squat without having a problem. Now that's just kind of like bracing an ankle sprain or putting a belt on when you're lifting heavy. You don't want to rely on something like that. So if we can improve the function of that joint, you're going to be better off. So there are some simple methods that you can do. Not going to have the time to go into today, but mobilizing the soft tissues of the calf, working on the motion, the ankle dorsiflexion range of motion on your own can be something that could be really beneficial for you. So test this out on yourself. If you find that it's a problem and you have more questions, don't hesitate to give us a call, email, and we'll be here to answer any questions we can for you. Dr. Scott with Synergy. Take care.